You're listening to Medscape's In Discussion series on myelofibrosis, a podcast where thought leaders and clinical experts share their diverse insights and practical ideas for optimizing patient care. This series is hosted by Dr. Tania Jain. Dr. Jain is an associate professor of oncology at the Johns Hopkins University School of Medicine, where myeloproliferative neoplasms are the focus of her research. And she's also the director of the Adult CAR T Cell Therapy Program for Hematological Malignancies at the Sidney Kimmel Comprehensive Cancer Center. Relevant disclosures can be found with the episode show notes on medscape.com or the Medscape app. The topics and discussions are planned, produced, and reviewed independently of advertisers. This podcast is intended only for use healthcare professionals.
Hello, everyone. We are in our Medscape in Discussion podcast, season 2, episode 2 today. I'm Tania Jain, your host, with our special guest today, Dr. Krisstina Gowin, who is an associate clinical professor at City of Hope Comprehensive Cancer Center, serving as the director of education at Chung Family Center for Integrative Oncology within the departments of supportive care medicine and hematology and transplant. She focuses on myeloproliferative neoplasms, but has also a passionate interest in integrative medicine. She's written a book called Living Well with Myeloproliferative Neoplasms, which, by the way, was a philanthropic endeavor and is still available on Kindle for download. Dr. Gowin, I've worked with her personally, and she's probably one of the most passionate people I know to support patients through their cancer journey. We'll talk a little bit with her today on the topic of living well with a myeloproliferative neoplasm. We derive that from the title of her book. Welcome, Dr. Gowin.
Thank you so much, Dr. Jain. It really is truly an honor to be on your podcast and your episode today. And I love all of the wonderful work you're doing for myeloproliferative neoplasms. So huge fan.
Well, right back at you.
Thank you.
We want to sort of figure out a way into the discussion of integrative medicine. So let me start by perhaps asking, we see patients with myeloproliferative neoplasms, and one of the sort of intriguing or the specific things there is that there's a lot of symptoms surrounding this diagnosis. Could you tell us a little bit about what symptoms do you encounter in clinic that you usually attribute to an underlying MPN?
For myeloproliferative neoplasms, one of the unique things about this disease is this heterogeneous kind of symptom burden, which was really beautifully defined by Ruben Massa, Robin Sherber, and others, and developed, as you know, a wonderful validated measure, the MPN symptom assessment form, which has been incredibly practice changing for us all, because we realize that we're now treating patients based on their symptoms and not just their blood counts and their splenomegaly, right? That it is new, it is a new endpoint that we're actually using in clinical trial design. We're using it in NCCN guidelines to direct when we potentially start a new therapy, a JAK inhibitor, et cetera. So it's really become not only something that patients are experiencing, but something for us as clinicians to use as a tool. And so I think that's one of the most impressive kind of movements forward for MPNs, but also for cancer care, right? To be thinking about symptoms as an endpoint, quality of life as an endpoint. So to get to your point about what are some of the things for myeloproliferative neoplasms, one of the biggest things is fatigue. 80% or more of patients with MPNs overall, and that's including PBET and MF, really have debilitating fatigues, and that can really be affecting their activities of daily living, ability to work, et cetera, et cetera. But many other things, difficulty concentrating, some of the more physiological symptoms can be itching, abdominal discomfort and early satiety, bone pain, weight loss, pruritus, which is a really tricky one, the itchy, which is so difficult to control. So it's really heterogeneous. It's kind of all over the map. There's a lot of psychosocial symptoms as well. Anxiety, depression, sexual dysfunction, right? And I think when we're thinking about symptoms, even as MPN professionals, sometimes these ones in particular get glossed over and perhaps underaddressed. So I always like to highlight the importance of those psychosocial sexual symptoms. So it's really a debilitating disease, myeloproliferative neoplasms. And Again, it's hard, I think, as providers because so often we're focused on the blood counts, right? We're focused on the size of the spleen, and that we really have to kind of take a step back and say, well, what's happening with you as a person and with your symptom burden?
I couldn't agree more. I think the spleen and the blood counts are those objective metrics that we're all used to. And I think work from Dr. Mesa and Dr. Sherber back almost a decade ago now
Yeah.
was instrumental in capturing the subjective metrics of the disease with the symptoms that you alluded to. Tell me how this plays into integrative medicine. You're cross-trained between oncology and integrative medicine, and I have to admit that the time when I heard from you that you're doing your fellowship in integrative medicine while you were doing your oncology fellowship was the first time I heard about the field. So pardon my ignorance, but I was very intrigued, very excited when I learned about that from you. Tell all of us about integrative medicine and sort of when or who should reach out to you for your expertise in this space.
Yeah, so you're not alone. I would say that the community is really starting to learn about integrative medicine now because it's really coming to fruition in mainstream medicine right about now in the last 5 or 10 years or so. So it's new, but it's up and coming and it's becoming very popular where we can hardly keep up with the demand, which is a wonderful problem to have. But I'd like to start maybe with just the definition of what is integrative oncology. And this was evidence-based. It came from the Society of Integrative Oncology where they convened an expert panel and said, okay, let's sit down and let's really nail this down of how do we describe what integrative oncology is. And what we're really talking about here is not just integrative medicine, but it's integrative medicine as it applies to cancer patients, and in specific here in the case of myeloproliferative neoplasm. But integrative oncology is defined as a patient-centered, evidence-informed field of cancer care that utilizes mind-body practices, natural products, and lifestyle modifications from different traditions alongside conventional cancer treatments. And that's truly what makes integrative oncology different from, say, complementary or alternative medicine. It's truly alongside our the best of what we have in true mainstream cancer care. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum. And I love this part. This is my favorite to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment in their survivorship phase. And so it's really, from my experience, is that it's empowering, right? Patients always come to me and say, what can I do? I'm taking my medicine, I'm showing up, I'm doing my NPM symptom burden, but I want to do more. What can I do? I want to be the driver of my bus. And so that's where I think the power of integrative oncology really shines, is because there are things that are tangible that can be led by patients and caregivers. Getting to your question, Dr. Jain, about when do we engage integrative oncology practitioners? And I think that is, when don't you? It's so incredibly important, particularly in NPN, thinking about lifestyle, thinking about stress management, thinking about symptom management. And so this particular group of patients, many others as well, but NPNs uniquely, I think, can benefit from integrative oncology. We have to certainly jump off into thinking about just the pathophysiology of the disease, right? Some of the complications. We're all worried about thrombotic complications. And even in our NCCN guidelines, it's talking about modifying the cardiovascular risk factors, right? That's part of our some of the hard endpoints and recommendations in our algorithm. So how do you do that? It's through lifestyle. Lifestyles, nutrition, exercise, stress reduction. So we need to be doing that from day one, from the very beginning in diagnosis. And so I think that's the answer, probably, is engage the team early on. And I think the key too is the team, quote unquote team, is different depending on where you are, in every academic center, community center, there's going to be different resources around you. And so I think part of our work is to better understand who are the teams around us, what are the kind of referrals that are possible, and just start to kind of create some of those workflows of, okay, how wonderful to have an integrative oncology center. But if not, there's a nutritionist, there is a physical medicine rehab person, et cetera, et cetera. Just trying to kind of work through all of the different modalities that potentially can be helpful and creating those referral patterns.
That's beautiful. You're prompting me to ask you now because I get this question so often in my clinic from patients, exactly as you said, what can I do? And a version of that is, what can I do in my diet, or what should I do in my diet to mitigate some of the risk from MPNs? And I'm sure that's a question that's asked in many clinics, not just MPN clinics. So what guidance do you usually provide when you get asked this question?
Yeah, it's a really great question. And you're exactly right that it's a uniform question, that it's not a myeloproliferative neoplasm patient specific question. I get it when I see breast cancer patients or prostate cancer patients. And it's pretty uniform. And some of our data really is borrowed from the cardiovascular disease research, where we really look at the impacts on inflammation. Really, what we're trying to do through all these modalities in integrative oncology, but in particular nutrition, is to modulate inflammation. And inflammation, as you know, is one of the hallmarks of what makes a cancer cell in that wonderful paper by Hand in Hand et al. Looking at, all the hallmarks. And tumor promoting inflammation is there. And so, how do we impact that? Well, lifestyle and nutrition. And so, the best studied, kind of a long winded answer to your question, the best studied diet is the Mediterranean diet. It really is the best studied and really shows the most potent impacts on inflammation. And importantly, for the NPN community, impacts on cardiovascular health, lower risk of cardiovascular events such as heart attacks, as well as cardiovascular death and overall survival, as well as impacted. In that large study, it's called the PREDIMED study, and there was over 7,000 patients. They actually did a meta-analysis looking at the incidence of breast cancer in that study, and those that were eating the highest quartiles of this Mediterranean-like foods had a lower incidence of breast cancer. That's not a randomized controlled trial, but it's certainly a provocative meta-analysis. So Mediterranean diet, I think, is really the way to go. So what is included in that? And probably most of everyone knows what are the components, but certainly lots of fruits and veggies, non-starchy, lots of color, lots of omega-3 fatty acids, and really trying to be sure that you're not getting any processed foods, right? Processed foods, there's more and more data coming out about processed foods and the impacts on quality of life, brain function, even telomeres. It's crazy. I always tell patients to really grocery shop on the perimeter, the inners of the grocery stores where all the evil comes. So stay on the perimeter, people. No, so eating whole foods, lots of fiber, lots of color. That's the recommendation. And we're looking at impacts in NPNs. Dr. Angela Fleischman from UC Irvine, who's now my neighbor. I'm really excited to be very close. I hope that we can start working more closely together. But she's done some interesting work on looking at the Mediterranean diet in NPN patients and showing that, at least in small studies, it's impacting inflammation, impacting cytokines, but also impacting our microbiome, which is so important. It's our second brain. It's another immune system. And we're showing more and more how important the microbiome is for cancer outcomes. And so with a Mediterranean diet, there's enhanced diversity. And that's really what we're always looking for in microbiome research is diversity, diversity, diversity. So for all of those reasons, I recommend the Mediterranean diet.
Well, that's beautifully answered. And certainly I think probably spans beyond MPNs, the role of inflammation in a lot of diseases and diagnoses within and outside of oncology. Maybe I'll take this opportunity to have you answer another question that I stumble upon in clinic and struggle with answering, which is what is the role of exercise? Again, some things that patients want to do and wonder what a good exercise regimen or exercise routine to have for wellness in general and specific to MPNs. I used to hear you talk about Tai Chi a lot during fellowship, so maybe that'll be a part of the answer, but excited to hear from you what your thoughts are on that.
It's part of that lifestyle prescription, and exercise is essential. Absolutely, and it totally influences quality of life, inflammation, disease outcomes we see in large data sets from breast cancer, prostate cancer, colon cancer. We just published a review paper in Mayo Clinic Proceedings looking at lifestyle and cancer. So we had to go back and forth with the editors because our tables were so long from the amount of data for lifestyle and cancer. So why we don't have a prescription pad and actually hand it over with our aromatase inhibitor for breast cancer, I don't know, because we need to. It is medicine. Exercise is medicine. But to back up for a minute, for the myeloproliferative neoplasm patient population, the data sets are limited, right? There's not a lot of research yet, certainly nothing as robust as in breast cancer and colon and prostate cancer. We have to borrow, right, from the knowledge of what's happening in other cancers and also put a call out for research that we need more data in MPNs. Anecdotally, I will say I have seen benefit in clinic. I can also speak to some of the smaller studies that there was a feasibility study about 50 MPN patients looking at aerobic and resistance training, and it was feasible to do these kind of interventions in MPN patients. And we also did a yoga trial looking at the impact of yoga. This was all remotely delivered on MPN symptom burden as well as some of the markers of inflammation. And we did see that there was a statistically significant reduction in tumor necrosis factor alpha in those that were participating in only 10 minutes of yoga a week, if you believe that. And that, although the sample size was quite small, around 40 patients, that there were some effect sizes looking at sleep and depression and anxiety. We need more research in the MPN population, but my recommendations are certainly to undertake a exercise regimen. We can use recommendations from the American Cancer Society, which is 150 minutes of moderate intensity exercise per week if patients can tolerate it, with a mix of aerobic, resistance, and then I, as you mentioned, love meditative movements such as yoga and Tai Chi. And so I always try to put that into the regimen as well. So all three of those, aerobic, resistance, meditative movement, a couple moments on Tai Chi. So Tai Chi and yoga are some of the most evidence-based interventions in integrative oncology overall. There's quite a lot of data looking again in some of the other tumor types. Breast cancer in particular has huge amounts of data showing the impacts on quality of life and symptom control and even disease outcomes. And it's part of the guidelines that we have now. There are some guidelines that we've developed within the Society of Integrative Oncology for symptom management. We've done this now for symptom management of pain, of anxiety, of depression, and then most recently of fatigue. Those are all published within JCO and they are endorsed from ASCO. And so yoga and Tai Chi are both in the guidelines for pain, for anxiety and depression and fatigue. So they've made it into all of the guidelines. That's evidence-based and again endorsed by ASCO. So trying to find, again, community resources to get patients involved is wonderful. There's so many online resources now that you don't even have to go to the gym, especially in the era of COVID, that we had to really establish some new modalities to deliver these. And so it's so accessible, but hugely evidence-based. Exercises is definitely part of the regimen.
That's beautiful. And yes, certainly something that goes beyond MPNs or beyond even any diagnosis to think about I'm going to pivot a little bit towards your book now. And I think I remember there's a section on complementary therapies in addition to, I guess, JAK2 inhibitors or other strategies that we think about. Tell us a little bit about how you approach that in clinic. What beyond JAK2 inhibitors can we do?
From a pharmacologic standpoint, I am very cautious and conservative when it comes to supplementation. And so, curcumin, for example, is a derivative from turmeric, the active ingredient from turmeric. It has been widely studied for impacts on inflammation, actually, as a natural JAK-STAT inhibitor. But we're very careful because there's been very few, no studies really beyond mouse models looking at safety and efficacy of combination therapy with JAK inhibitors as well as curcumin. And so, first premise, right, is do no harm. And I really adhere to that, but particularly with supplements, I'm very careful. So, from a complementary approach, what I like to do is to really look at the guidelines. I had mentioned the ASCO guidelines, look at the symptom and say, what's the best evidence base for a complementary modality for this particular symptom? So, for example, cancer related pain. We know acupuncture has a pretty good amount of evidence for it for management of pain. And so consider acupuncture if they're open. Reflexology is also in there. And if they're afraid of needles, you can do acupressure. Massage actually has data for improving cancer related pain, particularly in breast cancer. So, those are kind of some non pharmacologic interventions that have a very low risk, but potentially a very high yield in managing symptoms. Other things we talked about yoga, but yoga's in the pain guidelines as well as guided imagery with progressive muscle relaxation. So, all of these modalities have enough evidence to be recommended to try for cancer related pain. We also look at procedural pain, kind of put that in a separate category and looked at the data for that. And hypnosis can be helpful for, say, bone marrow biopsies. Acupressure, again, acupuncture, music therapy, all can be helpful for that kind of associated pain. Anxiety and depression, there's a whole different kind of set of guidelines, I would say, that you can follow the algorithm. Really nice publications within JCO last year about that, but very similar interventions. Mindfulness, yoga, relaxation, music therapy, Tai Chi, Qigong is in there. For me, I start with those that have the most evidence for them and have the least risk for harm. I will say that when it comes to supplements, one of the supplements did actually make it into the guidelines for fatigue, and that is American ginseng. So the quality of evidence is low and the strength of recommendation is conditional, meaning that you can consider trying it. I have tried American ginseng in some patients and it has made impacts, absolutely. And especially with a patient who's refractory to some of the other modalities, right? They're already doing the things. They're adjusting their diet, they're doing their exercise, they're doing their mindfulness. They've tried acupuncture and they're just really refractory. That's usually the kind of patient that I'll have the conversation around American ginseng. That's kind of how I tailor it, but I would say that there's no one size fits all, that I listen to patients and say, what's meaningful for you and your culture, right? There's so many folks that come from different areas around the world that already in their mind have what they think is going to be the most potent and beneficial strategy for them. And I like to kind of evaluate that, turn that stone over and say, well, is there evidence for that? Can we support that? Because if the patients are already interested in that modality, it's more likely to be effective.
Wow, that's beautiful. I wish I could continue hearing about this because everything that you've told us today or spoken about today is a learning point that I think all of us who are listening to this will be implementing in our clinics easily and quickly and tomorrow or today. Any last words, Dr. Gowin?
Some of us are undergoing burnout or having our own health issues. And so as we practice this kind of counseling in clinic, it's our own reminder to do this for ourselves.
That is beautifully put, and I agree, a beautiful reminder for all of us. Well, with that, we're gonna end. I'm sure I speak for all of us that we are very, very thankful to Dr. Gowin for sharing her expertise, for sharing her thoughts on this critical, delicate, and important topic that we encounter on a frequent, maybe daily basis in our MPN clinics. We're going to come back with our episode 3. Stay tuned. Thanks again, Dr. Gowin. Thanks, everyone.
Thanks for listening to Medscape's In Discussion Myelofibrosis podcast series with our host, Dr. Tania Jain. Be sure to look for more In Discussion episodes wherever you get your podcasts. Check out medscape.com or the Medscape app for show notes, links, and more information on myelofibrosis.